My name is Mervyn Robinson and I'd like to talk about the toxicological pathology of the eye. This presentation will be divided into a number of sections. In the first section I would like to give a few general comments by way of introduction, which will cover general aspects of toxicology as they apply particularly to the eye. Then I would like to concentrate on three anatomical portions of the eye which are often found to be the most important with regard to toxicology, that being the cornea, the lens and the retina. I'll then follow on by a few words about the methodology and finish up talking about eye irritation tests. Quite often toxicologists often say to me, why be interested in the eye? After all, the liver and the kidney are organs which are much more interesting, have much more toxicology about them, many more compounds affect these organs, and this is the reason why I show this eye. This is a human eye from a patient some years ago who had been treated with Practilol, a beta blocker, and as you see, this is a non-seeing eye. There's tremendous corneal change, there's massive fibrosis and swelling in the conjunctival fornix, and I think we'd all agree that this is rather a disastrous eye and a disastrous circumstance which can happen to someone. So that is one of the reasons why I think toxicological pathology of the eye is an important subject. So, importance then. It's certainly emotive. Toxicology of the eye, diseases of the eye tend to raise a great deal of emotion, even though the eye itself is not an organ upon which life is dependent. It nevertheless instills an awful lot of emotions. The second reason why it's important is that we can always examine the eye very easily in life. It's a little like the skin. We can do gross examination at any time, either as in spontaneous disease or as part of experimental procedure. And particularly by the use of many ophthalmic equipments, the structures and the changes in these structures can be readily ascertained. The third reason why toxicology of the eye is important is that the eye contains a vast range of different types of tissue. It contains epithelial tissue in the case of the cornea. It contains very specialized tissue, the lens, of which there is no real counterpart anywhere else in the body. It contains very sensitive nervous tissue, the retina, and it contains a large vascular network, a large vascular bed, which often contains, in particular species and strains, often contains large deposits of melanin, which can be important with respect to toxic substances. So because of all these various tissue types and their different biochemistries and physiologies, then this means that there are many opportunities for toxic damage. And sometimes this toxic damage can be demonstrated with exquisite sensitivity. This slide shows an example of that, where a particular compound that we dealt with some years ago showed the no effect level for general toxicity in rats, that is in terms of body weight reduction, was greater than 12,000 parts per million, which is a considerable dose. Whereas the no effect level for the effect on the eye was much below 10 ppm and probably nearer 5 ppm. So there's a tremendous range of sensitivity there, and the eye often exhibits this marked sensitivity. The circumstances under which we may encounter ocular toxicity. First of all, we see it during experimental studies in animals. These are studies which are being conducted as part of a safety evaluation program, either for drugs or for industrial chemicals or for agrochemical substances. And we may see these as an expected finding according to the structure of the compound, or we may see them purely as an incidental finding during the course of the study. And they can be seen at any stages during the study, either as an acute effect, or we can see them sometimes as purely a chronic effect. We also encounter ocular toxicity as a result of side effects when a drug is on the market, this being either in animals or in man. And many of the quoted examples in the literature of ocular toxicity refer to this category of ocular toxicity. And of course, thirdly, we see ocular toxicity as a result of accidental exposure to chemicals, either in man or in animals, and this is usually as a course of direct exposure to the surface of the eye. The species that we use covers the full range: rats, mice, dogs, non-human primates and rabbits. Rats are the most favoured species for studying ocular toxicity, together with dogs. In much safety evaluation, we generally use only dogs and rats for ocular toxicity examination. With respect to mice, although mice can give considerable amount of information, the size of the eye in mice does not lend itself particularly well to gross examination by ophthalmoscopy, and in certain strains of mice there is heavy pigmentation. In the C57 black mouse, the strain that we normally use, there is marked pigmentation in the eye. It's a heavily pigmented strain, and consequently examination of such a heavily pigmented eye is not all that easy. Also, in mice it can sometimes be rather difficult to obtain adequate dilatation of the pupil for examination, particularly again when the animal is heavily pigmented. So mice are not that frequently used. Non-human primates are used in special circumstances to answer specific questions, and their use is not routine in terms of safety evaluation. And rabbits, of course, tend to be confined, the use of rabbits tends to be confined mainly to eye irritation studies, and we'll cover that subject a little later on. Of course, in terms of laboratory animals, most laboratory animals, with some exceptions of course, but most laboratory animals are albinos. And there's been considerable debate over the years regarding pigmented versus non-pigmented strains. Should we use a pigmented strain because man is pigmented, or most males, most of humans are pigmented? Or should we use a non-pigmented strain where we have more information on the background incidence of disease? Or should we use a combination of the two? And there are clearly differences between pigmented strains of animals and non-pigmented strains. There are anatomical, physiological and biochemical differences, which all of them can be important with respect to the response of a toxic chemical. This slide gives some of the difficulties and some of the possibilities of the differences between pigmented and non-pigmented strains. Albino animals can be more susceptible. And an example, vigabatrin is given there. Albino animals may, under some circumstances, be less susceptible than the pigmented counterpart, and naphthalene cataracts gives an example of that. The compound, on the other hand, may accumulate in pigmented tissue, but there may not be any ocular toxicity. Alternatively, a compound may accumulate in pigment, but the ocular damage can occur irrespective of that pigmentation. In other words, it doesn't matter whether it accumulates in the pigment or not, damage still occurs. Chloroquine is an example of that. The last one on this slide here, compounds may accumulate in pigment, but the toxicity happens to occur in non-pigmented tissue, and Tillerone in rats is an example there. Alternatively, the difference between a pigmented strain and a non-pigmented strain may be purely due to the fact that they happen to be different strains and have nothing to do with the pigmentation whatsoever. So whether we use pigmented or non-pigmented animals is a difficult question to answer, and it hasn't been resolved yet. Under most circumstances, of course, we tend to use an albino rat and a pigmented dog, but this doesn't always give us the answers we require. The depth of study in safety evaluation or ocular toxicity tends to vary depending on the use of the compound for which we are studying. And agrochemical substances, industrial chemicals, tend not to be studied in the same depth as human non-ocular drugs, which in turn are not studied in the depth of human ocular drugs. So the level of examination will vary depending on the use to which the substance is going to finish up. It's important to remember that the eye has only got one function, and that is photosensory reception. It doesn't do anything else as far as we know. It doesn't secrete hormones. It doesn't have any direct action on any other part of the body, like many organs in the body do. So the adverse effects of any chemical substance will be on the function of photosensory reception. It's important also to remember that photosensory reception is not the same as vision. For vision, we need a brain and we need the adequate neural connections as well. And the components of the eye which give rise to this function can be divided into three parts. There's the organ, or the part of the organ which, under which the photosensory reception takes place, the retina. There's also transparent structures. The eye requires transparent structures to function properly. If these are adversely affected in any way by a toxic chemical, then the eye will not function. And thirdly, and this is a point which is often forgotten, that the eye also needs rigidity. Optical instruments must be rigid to function. Flexible, floppy microscopes don't work too well. They are rigid structures, and the same applies to the eye. And a number of the components of the eye contribute to this rigidity. So we have the very dense sclera, the collagen fibres in the cornea, and the ocular fluids which help to maintain rigidity. And whenever a chemical substance acts adversely on any of these three components, then there is toxic damage. Okay, this is the well-known diagram of the eye, where the rigid structures are represented here on the outside by the sclera and advancing forward to the surface as the cornea. Within the globe of the eye, of course, is the semi-solid vitreous and the aqueous humor, which hydrostatically also help to maintain rigidity. The photosensory component, the retina, passes from the ora serrata here right round to the back of the eye, where the fibres enter the optic nerve. The eye is supplied with a very rich vascular structure, the choroid, and the iris and the ciliary processes. The ciliary processes which also secrete the fluid component of the aqueous humor. So now let's turn to the subject of the cornea. And I'm going to cover these, the toxicological pathology of the cornea in these three sections. I'm going to say a word or two about the anatomy and function, and particularly the aspects of that which relate to toxicological pathology, things which are important. And then I'm going to cover the basic pathological reactions which take place in the cornea. And thirdly, I'm going to cover a classification of the corneal toxicology and talk about some of the circumstances in which the corneal toxicology can arise, and say a word or two about the mechanisms. So starting with the anatomy and function. On the outside is the precorneal film, often forgotten but extremely important, as we'll learn later. Underneath that is the epithelium, consisting of a variable number of cells depending on the species being studied. And underneath that lies the Bowman's membrane, which is present only in primates. The bulk of the cornea is made up of the collagenous stroma, which provides rigidity to the cornea. We then have a thin membrane called the Descemet's membrane, which in H&E section is sometimes not readily visible, particularly in rodents. And on the inside of the cornea lies the posterior epithelium or endothelium, which has an extremely important function with respect to the pumping of fluid and ions. The precorneal film, as we've said, is extremely important with regard to the nutrition and oxygenation of the cornea, and it consists of three layers: an oily layer on the outside, an internal aqueous layer which forms the bulk of it and is produced by the lacrimal glands, and an internal mucoid layer. This slide of a normal rat shows that the precorneal film provides a smooth, glistening appearance to the corneal surface. And any break in this precorneal film will result in apparent opacities. Here we have a rat which was treated with a chemical which caused a temporary interruption in the precorneal film, and we see the surface here is rather pitted and irregular, and these changes could be described by the unwary as being early opacities on the surface of the cornea. However, after several hours after treatment with this particular chemical, the cornea returned to its normal smooth glistening self. So purely interruptions in the precorneal film can give the appearance to the unwary that there are opacities on the surface of the cornea. And irrespective of this, happens to be an example produced by a chemical, but normally when a large number of rats are being examined in the course of a toxicological study, it's possible to get a certain number of them which have breaks in the precorneal film, giving a sort of crazy paving appearance to the surface of the cornea. And in these circumstances, it's probably better to leave the animal and return a short while later when the precorneal film has established integrity again. The precorneal film has microvilli on its surface to help stabilize the material and hence provide this smooth, glistening appearance. The epithelium of the cornea, in the rat at least, contains about 4, maybe 5 cells, and is produced by these basal cells which gradually divide and move upwards to form more squamous elements, which are then desquamated. The turnover rate is around 7 days, but in cases of pathology, when there is extreme pathology, the turnover rate can be much faster than that. As you see, the basement membrane is not clearly visible in the normal H&E section. The bulk of the cornea is made up of the stroma, which consists of parallel lamellae of collagenous fibres and a sparse scattering of these keratocytes, which are modified fibroblasts. In man, there is this layer underneath. This slide is from the cornea of man. There is this layer underneath which is cell-free called the Bowman's layer. This section is a semi-thin section, tall blue semi-thin section from a normal rat's eye, and it shows an additional feature, and that is the presence of these dark cells at the base of the corneal epithelium. And these are believed to represent artifacts produced by aldehyde fixation. Because this eye was, this cornea was going to be prepared for electron microscopy, it was fixed in aldehyde fixatives and gave rise to these dark cells at the base here. And sometimes these can be misinterpreted for pathological change. The posterior endothelium or epithelium in normal H&E section contain rather uninteresting cells, but this belies their very important function with respect to the pumping of sodium and potassium and water maintenance of the corneal surface. And underneath these cells, of course, lies this very thick, in this case very thick, Decimus membrane, which increases in thickness with age. Normally the Decimus membrane is very difficult to see in H&E section. This is a PAS stain section from a very old animal. It happens to be a horse, and shows that there is increased thickness with age, and it takes on this very thick layer as you can see here. This PAS section also shows at the top here the very thin basement membrane of the epithelium. The endothelial cells under spectroscopy have this hexagonal appearance, and sometimes this method is used to study abnormalities in these cells. Okay, well, corneal transparency depends on a number of those anatomical features which we've talked about. It depends on the relative degree of dehydration of the cornea, and anything which interferes with this dehydration, and particularly the cells which help to produce this relative dehydration, i.e. the endothelial cells, will tend to adversely affect the transparency of the cornea and produce toxic damage. The avascular nature of the cornea is important with respect to transparency as well, and corneas in which there are vessels growing will be opaque. The regular arrangement of the cells is an important feature, not only the regular arrangement of the epithelial cells, but the regular arrangement of the keratocytes in the stroma. And anything which interferes with that regularity will also tend to produce corneal opacity. The stroma, the cells in the stroma are few in number. If the cells in the stroma increase in number, this will cause reflection and refraction of light, and hence will produce opacity. And of course, the lack of pigment and keratin is an important feature of the cornea to prevent the obstruction of light passing through it. And even heavily pigmented animals are free, the cornea is free of pigment. So this section shows, this slide shows a list of some of the features of the anatomy which are important in the toxicology. The avascular nature, which we've mentioned, is extremely important because it tends to modify the type of reaction that one obtains. The fact that oxygen and nutrition come via the tears or aqueous is important because it also means that toxic chemicals may arise via this route as well. The epithelium is non-keratinizing, but it's a very labile epithelium, so it can respond very rapidly to change and show tremendous powers of regeneration at times. And perhaps the most important aspect here is that transparency is essential for normal function, and anything interfering with that transparency by whatever mechanism will adversely affect its function and be rendered toxicologically significant. And of course, the posterior epithelium is essential for the degree of hydration. So moving now to some of the pathological reactions that take place in the cornea, and to a large extent the type of reaction that occurs in the cornea is similar to the type that can occur, for instance, in the skin, which is a very similar structure. So we have inflammation or keratitis. Now, because the structure is avascular, the purists may argue that you cannot get inflammation of a non-vascular structure. But I don't want to go into that debate here, but at least the features of inflammation are very readily available for study, quite often in many cases in toxic damage of the cornea. The cells of the cornea may undergo degeneration, dystrophy or necrosis, and the cornea may undergo edema, which is extremely important with respect to the opacification of the cornea. In certain circumstances there can be deposition of abnormal substances, and these can either be of endogenous origin, such as calcium, or of exogenous origin, such as metabolites from a particular chemical substance. Other important facets of the pathology are the reactions to the healing and repair process and regeneration. These tend to be rather special in the cornea, and we'll talk about those in a bit more detail later. We've got neoplasia down as the last point, although neoplasia of the cornea is extremely rare as a toxicological event at least, and certainly in laboratory species is extremely rare as a spontaneous event. There are examples in veterinary pathology of neoplasia of the cornea, but in the laboratory we tend not to see them very often. So that's all I'm going to talk about that subject. The first aspect I want to cover then is inflammation or keratitis. And this slide of a rat's eye shows the appearance of an early focal keratitis. Here we have a clearly demarcated area of opacity, which with a bit more time can become more diffusely spread, almost multifocal in appearance, giving a rather pitted appearance to the surface of the cornea. It's interesting in this particular case, although you can get true anatomical pitting of the cornea, in this particular case there isn't real pitting of the cornea as shown by histology. The apparent pitting is probably due to breaks in the precorneal film and reflection and refraction of light giving the appearance of pits. And with time, areas of keratitis in the eye can extend over a large surface of the corneal surface and show these branching vessels growing from the limbus of the eye to the centre of the area of inflammation. This slide shows most of the features of a toxic-induced keratitis that may be encountered. We have changes in the epithelium. This epithelium contains many more than 4 or 5 cells thick, therefore it's undergone hyperplasia. Another interesting feature is that there are cells in multiplication at areas in the cornea, corneal epithelium, where they're normally not seen. Normally we only see mitoses dividing cells at the base of the epithelium, and the presence of mitoses further up tends to denote some alteration, some abnormality in the division process. The stroma shows a large inflammatory cell infiltrate. In this case it's a fairly mixed infiltrate, and perhaps there are more mononuclear cells in it than polymorphs, although the actual cell type can vary depending on the nature of the particular keratitis involved, or perhaps more importantly, the stage at which the keratitis is at, whether it's acute or a more chronic type. This slide also shows the blood vessels which have grown from the limbus into the substance of the stroma of the cornea. Note that the posterior part of the corneal stroma is fairly free of inflammatory cells, and in my experience this seems to be a fairly common feature in that most forms of toxic-induced keratitis, at least, tend to involve the outer parts of the stroma and the epithelium rather than the internal parts. The next pathological reaction to mention is the one of degeneration or dystrophy or necrosis. This slide shows early dystrophic change in the epithelium, giving this characteristic V-shaped appearance of the cells. The cells have lost their normal pattern of division and migration, and although this is a tall blue stain section, these cells resemble more the basal cells which are present in the elements lateral to this particular lesion. So this shows an early dystrophic change, this particular example being one caused by a chemical substance. Of course, the degeneration aspects of the cornea as a result of toxic damage can be much more extensive, as is shown here. There is also inflammatory changes going on in this particular cornea, but a large proportion of the cornea has undergone lysis and has suffered tremendous degenerative changes. And these can go on to such an extent that there can be true ulceration and penetration of the eye by the process which is taking place. It's interesting here that the part of the epithelium still seems to be attached, although the lytic part of the change in this particular example seems to be more in the stroma than in the epithelial tissue. In certain cases, of course, there can be true ulceration, as is seen in this particular example here, where the rest of the cornea is opaque and there are blood vessels growing towards the area of ulceration. When there is penetration of the eye, then it's possible for the iris to protrude through the area of ulceration. And in severe cases, of course, not only the iris but also the aqueous humor can flow out of the damaged area of the cornea and on contact with the air can solidify and form this jelly-like mass which you see here. This slide happens to be a sheep, but shows very nicely that penetration can lead to loss of structures through the eye. Here we have a severe case of keratitis in this particular example with rupture of the eye and penetration through the orifice of the iris to the outside world. There will also, of course, be adhesion or anterior synechia between the iris and the corneal endothelial surface. Edema is an extremely important component of the pathological spectrum that can occur in the cornea, and many of the examples that are seen in practice with respect to pathological change, there is usually an element of edema taking place there. Edema in the eye tends to be more of a uniform opacity, often giving a bluish appearance to the eye, and usually is seen, as in this example, as a uniform pearly white appearance. Sometimes in long-standing cases, of course, there can be additional changes as well as the pearly white or bluish appearance to the corneal edema, and in this case there is some pigmentation, some pigment cells growing in. But whatever the cause of the edema, whatever the actual cause, then it is usually as a result of some change in the corneal endothelium, either toxic damage to the corneal endothelium or some change in some way to the pressure which is exerted on the corneal endothelium, as is exampled in the case of glaucoma. This particular section is taken from a guinea pig where there is quite an inflammatory process going on, but it shows also some of the histological features of edema. There is clear thickening of the cornea. This cornea is probably at least 2, maybe 3 times as thick as is normal, and on higher power gives a very clear indication that there is a uniform separation of the collagenous fibres which normally occur in the cornea. And it's this uniform separation of collagenous fibres which give indication that this is true pathological edema. We also often get artifactual separation of the fibres in the cornea. The eye is not the easiest organ to process in the world, and frequently we see artifactual separation of the fibres, which to the unwary sometimes may give the appearance of possible edema. And this is such an example of that, where the corneal epithelium is perfectly well preserved, but the corneal stroma gives the appearance of a lace-like structure. But you'll see that there isn't uniform separation of the fibres, and the fibres are in certain interconnecting bands of tissue, and this is not the appearance you tend to get with true pathological edema. Okay, the fourth category of pathological change is the deposition of abnormal substances. And this is an example of such a deposition of abnormal substance. This happens to be from a human cornea and shows an extreme case of familial amyloidosis of the corneal surface. And there is massive deposition of amyloid in the upper parts of the cornea, causing thinning of the corneal epithelium. But the sort of deposition that we more readily encounter in toxicological pathology is shown in this slide here, where we have these small blue deposits, these basophilic deposits, particularly common in the basal parts of the corneal epithelium or in the basement membrane, and these are calcium deposition, which is far more commonly seen. The next category to consider is the various sorts of reactions that may be encountered as a result of the healing, repair and regeneration process. And this slide here shows an example of that. There is a severe keratitis which has caused lysis of a large proportion of the corneal stroma, and the epithelium has undergone squamous metaplasia to produce this massively thickened band of keratin. This is clearly a non-seeing eye, and one of the natural reactions of the body to prevent damage, further damage, and to undergo the healing process has inadvertently, in the case of the cornea, caused a complete loss of function in the cornea with respect to transmission of light. The same thing happens, of course, with the migration of pigment. In this particular case of keratitis, there is a severe keratitis in this section with massive inflammatory cell infiltration, and there's been adhesion of the iris to the surface of the cornea, and as a result of that there's been migration of pigmented tissue into the surface of the epithelium. And this pigmented tissue, of course, will, as with the keratin, prevent the passage of light and obscure the adversely affect the normal function of the cornea. This is an example of a rat's cornea where there is abnormal deposition and abnormal alignment of the fibres, the collagenous fibres. And this is a case of scar tissue formation. This is a small scar in the surface of the cornea, and this abnormal deposition of collagen will result in the reflection of light and give rise to an opacity, as it did in this particular case. This is quite a rare thing to see in the rat, because the rat tends by and large to not give rise to very much collagen deposition in the cornea when compared with other species like rat and man. But this is an example of a toxic-induced keratitis, which after administration of the compound left the cornea with this area of disorganized scar tissue formation. Another thing that one may encounter as a result of the healing process is the presence of blood vessels in the corneal stroma which are devoid of any blood. These are the ghost blood vessels which can remain after a severe keratitis once the inflammatory cells have disappeared. Here we have an example of there is some proliferation here of the endothelial cells with possible deposition of iris tissue, and this is the result of synechia, which has occurred during a severe inflammatory process which is taking place in the cornea. And of course, we have neoplasia as the end feature of the pathological reactions. Now moving on to toxicological aspects of corneal pathology. The first part I'd like to talk about are the abnormalities that are created as a result of primary abnormalities in the precorneal film. We said earlier that the precorneal film was extremely important with respect to the maintenance of the eye and the normal integrity of the eye, and you can see there that that this forms one of the possible types of abnormality that can occur as a result of toxicity. This section here, this slide here, shows an example of that, where there's been a natural loss of corneal film, precorneal film, and has caused massive abnormalities to the surface of the eye. So this exemplifies how important the precorneal film can be. And there are two circumstances whereby there can be a primary abnormality in the precorneal film. The first one is where there is a toxic-induced disease of the lacrimal apparatus, which provides the tears. And the second possibility is where the compound on the question has a pharmacological activity on the secretion of tears. In the case of primary disease on the lacrimal apparatus, an example of that is administration of 5-amino-salicylic acid, or 5-ASA. But sulfur drugs, a number of sulfur drugs, can also produce these abnormality on the lacrimal apparatus, as can trimethoprim. And these changes have been described in the literature mainly in dogs. And they induce a similar disease to the spontaneous autoimmune disease, whereby there is tremendous destruction, inflammatory cell destruction of the lacrimal glands, which consequently reduces the secretion of tears. This slide shows some data from a study with 5-ASA and gives the Schirmer tear test results, a test for the secretion of the amount of tears in various groups of beagle dogs. As you see from this slide, at week 22 there was a considerable reduction both in males and females in the treated groups as compared with the controls of the mean reading in millimetres of the Schirmer tear test. And these animals had been administered various dose levels from 40 to 100 milligrams per kilogram of 5-ASA. This slide shows the normal appearance of the lacrimal gland in the dog. And when that's compared with the treated animals, you can see that in the treated animals there is considerable destruction of the acini caused by infiltration of these mononuclear cells, presumably with a considerable cytotoxic activity. And this appearance is rather similar to the appearance that one gets in, for instance, Sjögren's syndrome in man, which has an autoimmune basis. This slide here shows the appearance of one of the dogs on the study, and it's particularly characteristic that there is abnormality in the corneal surface, as shown by the broken reflection of light here, but frequently these dogs also showed tremendous mucoid secretion and coagulation, particularly at the medial canthus, as is seen here. Histologically, the appearance is one of a keratitis with inflammatory cell infiltration, particularly in the outer stroma and within the epithelium itself. And it's considered to be related to devitalization of the tissue due to lack of lacrimal secretion, lack of the normal tear film, and due to the possible invasion of normal commensal bacteria which gain an access to the corneal surface and cause this inflammatory process. But the changes are one typically of a keratitis. The second category of corneal change, where there is an abnormality in the precorneal film, is due to the pharmacological activity of the compound. And there are some examples of this here. The administration of anaesthetics in rodents causes the eyes to remain open for long periods of time, and this will result in a drying of the corneal surface. And administration of any anaesthetic agent such as morphine is quoted as an example of this type of change. Anticholinergic compounds such as clonidine also have been described as producing corneal abnormalities due to the abnormalities in the precorneal film. And in some cases of anticholinesterase compounds, and phenthyon is one example of that, also corneal changes have been described as a result of abnormalities in the precorneal film. This slide is of a rat's cornea which has been treated with clonidine and shows the typical keratitis of the abnormality in the precorneal film. Again, note that there is the bulk of the inflammatory exudate is towards the outside of the corneal stroma, but to all intents and purposes it's a straightforward keratitis. This example is from a mouse, a C57 black mouse, treated with a cholinesterase compound, and shows again a marked and severe keratitis. In this particular case, of course, there is a blebbing of material, presumably exudate material, on the corneal surface. And it's quite interesting to note that in this particular experiment, this compound happened to be a fungicide, but it also had anticholinesterase activity. It was particularly interesting to note that the incidence of lesions was frequently either bilateral or unilateral. and the pathogenesis of the disease was related to the lack of corneal lubrication by the tear film and possible bacterial infection which took place as well. The next type of change which can occur as a result of toxicity is as a result of direct application of toxicant to the corneal surface. And the substances which are usually described in the literature are acids, alkalis, surfactants and organic solvents which can produce this change. But there are chemicals from a wide variety of chemical classes which can result in these abnormalities. In the case of acids, clearly the damage is dependent on the pH, the strength of the acid, but acids tend to provide a self-limitation of the pathological reaction. And this is due to the fact that they induce coagulative necrosis. Alkalis, on the other hand, tend to produce a much more severe reaction. They induce saponification, they induce cell membrane damage, and because of this allow quite marked penetration of the alkali into the substance. Because of the saponification, there is a massive infiltration of polymorphs into the site, and these polymorphs tend to secrete collagenase substances, collagenase enzymes, which dissolve the collagen of the stroma. The breakdown products of this collagen in turn attract more polymorphs to the site, so you get this vicious circle of activity taking place, and this gives rise to the rather horrible condition of the melting ulcer. So alkalis are much more severe. In the case of organic solvents, there is a dissolving of the lipid resulting in epithelial damage, and of course surfactants may produce corneal damage, but the mechanism. This slide shows an example of a corneal toxicity caused by direct administration of a substance, and you can see here the severe changes that can take place as a result of this type of damage. The third category in the classification is where the chemical has been administered systemically. Now, although there are many examples of this where corneal toxicity has occurred as a result of systemic administration, in many respects it's not all that common to see in the normal safety evaluation business. But there are a number of examples which we'll now look at. And the types of change that can take place can range considerably. The types of pathological change that is encountered can be quite diverse. There can be a keratitis, for instance, as a result of administration in the diet of a substance, and an example of that is where tyrosine is administered at the 5% level in a low protein diet to rats, and this will induce quite a severe keratitis. Of course, photosensitization keratitis is another example of this type of change. Specific chemicals causing damage of edema as a result of systemic administration are not all that numerous, but 1,2-dichloroethane in dogs is an example. Many substances, however, do cause deposition of many chemical substances do cause deposition of substances into the eye, and these can be exogenous, as with chlorpromazine metabolites, or heavy metals such as gold or copper, for instance, or maybe endogenously derived, as is the case with vitamin D poisoning, which will result in calcification of the cornea, or this amphiphilic drug Tilarone, which causes abnormalities in the in the storage of material. This example here is a rat dosed with 5% tyrosine in the diet, and this is I think at about 3 days on, and here we have a very severe keratitis. There is marked exudation of material on the eyelids and quite marked swelling of the eyelids, in addition to the corneal hazy opacity which you can see in this slide. And this section here is one of such a case, where there is massive inflammatory cell infiltration in the cornea, producing this very, very severe keratitis, as well as quite a marked and severe conjunctivitis, with exudation of proteinaceous material and dead cells onto the surface, as well as the intense inflammatory cell reaction. This is an example of deposition of foreign material, where there is an accumulation of, in this case, polymucosaccharides in the lysosomes of the keratocytes, producing this vacuolated appearance to these cells. This is caused by the compound tellurone, and in this particular case seems to be particularly marked in the stromal tissue, although with some amphiphilic drugs causing deposition of abnormal material in the lysosomes, the corneal epithelium is more commonly affected. And here we have the lipid bodies which are deposited in the epithelium in this case, and this is an example caused by amiodarone, another amphiphilic drugs. And there are a number of these chemicals which are known to produce this sort of change. Chloroquine, of course, is another example of it. The next category in the classification process is where there's primary disease elsewhere in the eye. And here are some examples of changes in the cornea that can occur as a result of other damage in the eye somewhere else. And for instance, glaucoma will result in corneal edema. Conjunctivitis may produce keratitis. A cataract may produce glaucoma, as may cases of uveitis. The next part of the talk will be considering aspects of toxicological pathology of the lens. And we'll cover some anatomical features to begin with, particularly those which are important to the toxicology of the lens, followed by a description of the type of pathological reactions that we can encounter, both from an ophthalmological point of view and the histological point of view, and then we'll say something about the types of toxicity that may be encountered. Okay, this slide shows some anatomical features which are of some importance with respect to toxicology. The first is that the lens, like the cornea, is avascular, but perhaps more so than the cornea, the reactions, the pathological reactions that we encounter are more limited than they are, far more limited than they are with respect to the cornea. The second point is that the proteins from which the lens is made up are immunologically protected from the rest of the body. Therefore, this means that if the lens proteins gain access to other parts of the body, other parts of the eye, then they will stimulate an intense inflammatory cell reaction and an immunological reaction. And these are particularly important when it comes to severe cataracts. The third point is that the fibres of the lens are formed continually throughout life. There's no stopping in growing. The lens continues to grow. This means that the lens is susceptible to any compound which affects cell division, or is potentially susceptible to compounds which affect cell division, and also is susceptible to compounds which affect various parts of metabolism as well. The next important point is that fibres fuse at what are known as suture lines, and these seem to be anatomical or perhaps biochemical parts of the lens which are uniquely unique and seem to be the area at which cataracts first seem to start. The lens has very, very few powers of regeneration and repair, and to all practical points does not repair at all. So once a pathological change has taken place in the lens, then it will remain so. Transparency of the lens is dependent, as is the cornea, on a number of important features. The first one is the regular nature of the fibres. As in the cornea, the regular nature of the fibres of the lens allow the free passage of light, and any disruption in this regular nature will result in opacification, reflection and refraction of light trying to pass through it. The second thing is that the lens is relatively dehydrated, and as is the case with the cornea, this dehydration is brought about by a sodium-potassium pump which allows passage of water, pumps water out of the lens to provide a transparent structure. And any interference with this pump or any leakage of water into the lens will result in opacification. The third point is that the proportion of soluble to insoluble crystallines, the crystalline proteins of the lens, are important with respect to the maintenance of the transparency, and change in this proportion may and often do result in a cataract. This simple diagram shows the basic structure of the lens, where there is a capsule surrounding the lens and an epithelium on the anterior surface only. The fibres are continually formed along this epithelium and break off from the epithelium at a part on the equator known as the lens bowl, and gradually move into the substance of the lens. The internal part of the lens is the earliest part of the lens to be formed and contains the fetal nucleus. This diagram shows the structure of the suture lines, where the fibres pass from the anterior surface to the posterior surface, and the suture lines are produced because the fibres don't quite reach the whole of the diameter, and as the animal gets older, then these suture lines tend to become more branched, and this particularly occurs in primates and man in particular, where the suture lines can be very branched. In the laboratory species, they tend to be more of a Y-shaped structure, with the appearance of a Y at the anterior surface of the lens and the appearance of an inverted Y at the posterior surface of the lens. Whether the Y is anterior or posterior is quite useful, because this helps to delineate the position of an opacity when one is examining the laboratory animals. This section of a lens shows that the lens has extremely irregular fibres, as is seen here, and this regularity helps to maintain its transparency. This slide, a scanning EM slide, also gives this appearance of the very regular nature of the fibres, and the regular nature also helps the interdigitation of the fibres, which is an important part of the transport of various metabolic substances, because the lens is a highly metabolic organ. Although it appears as a simple glass bead to the naked eye, it is in fact very active metabolically, and it's active metabolically because of this constant addition of fibres, of new fibres to its structure. And the close interdigitation of these fibres allows diffusion from the metabolic of substances from the metabolically active epithelium down to the more metabolically inactive part of the lens, such as the centre. This slide gives a brief outline of some of the biochemistry that takes place in the lens, and as we said, this biochemistry is extremely important because it gives the opportunity for toxic damage. Interference with the biochemistry at any of the points will allow toxic damage to take place. Carbohydrate metabolism, energy metabolism, is mainly anaerobic and by glycolysis, but excess carbohydrate in the lens is metabolized via the orbital route. And this is important with respect to the cataracts, the sugar cataracts, which we'll mention later on. The lens is a very proteinaceous structure. It contains probably the highest concentration of protein in the whole body, and because of this high concentration of protein, active transport of amino acids into the lens is extremely important. And again, this is a site of possible toxic damage. Because cells are being added to the lens continually, then these cells require plasma membranes, and lipid metabolism is also of great importance in the lens. And interference with this lipid metabolism, again, may result in cataract formation. Because relative dehydration of the lens is important with respect to transparency, the ATPase pump is an important biochemical structure, and also is a structure and the site at which toxic damage may occur. There is a high concentration of glutathione in the lens, this helping stability of the SH groups on the lens protein and helps to prevent oxidative degradation by toxic chemicals. And the presence of high levels of ascorbic acid in the lens also help to prevent against free radical damage. So there are a number of features of the biochemistry which take place in the lens which are of extreme importance with respect to toxic damage. We'll now move on to say something about the pathological reactions that one encounters in the lens, and the first thing to say really is that these reactions are very limited. In other words, we don't see an awful lot of variety in the pathology of the lens. There can be abnormalities in the water content, and these can give rise to fibre swelling and degeneration. This swelling of fibres can give rise to total lens swelling and capsular rupture, and if the capsule does rupture, then there is release of these immunologically active lens proteins which then give rise to secondary complications. And any of these different types of pathological reactions will give rise to opacity or cataract formation. With the ophthalmoscope, there are a variety of changes that we see, and the first change is, in a number of circumstances, is actual increased transparency of the lens. This may seem a little contradictory, but the lens has a refractive index higher than 1, and in some early cataracts, very early cataracts, and indeed in some spontaneous cataracts produced in laboratory animals, we see an increase in the transparency and an increased ability for the transmission of light. And animals showing this increased transparency, it's actually possible to visualize the retinal vessels without any ophthalmic equipment. This then rapidly moves on to produce either areas of vacuolation or areas of focal opacity. In the case of focal opacity, these usually, but not necessarily always, occur first in the posterior pole of the lens. and this may be preceded in some instances by an increased prominence of the suture lines, and frequently the focal opacity at the back of the lens features around the lines of the suture lines. This then gives rise to the triangular posterior opacity, which follows the line of the suture lines, and the more severe type of opacity occurs when the whole of the lens is involved in the opaque or cataractous procedure. And this is the mature cataract. With increasing time, however, the mature cataract can become hypermature and give rise to areas of clearing called Morgagnian change. And when this occurs, there is frequently loss of this fluid material inside the lens, which then may give rise to capsular shrinkage. And the other change that we may see with the ophthalmoscope are features of the complicated cataract. The next few slides show some of these features. And here we have an early cataract showing the triangular nature of the posterior cataract following the posterior suture lines. This then gives rise to the complete cataract, where the whole of the lens surface and a large amount of its depth is affected by the cataractous process. In some cases, we see early clearing again at the suture lines here, as is seen in this mature cataract, where there's the beginnings of clearing in the centre of the lens and particularly around the suture lines. In many cases, complete cataracts, which are produced by toxic chemicals, initiate in addition quite an intense iritis, as is seen in this case. This animal had been treated with a mydriate, but the iris had not dilated, had not responded to the mydriate, and it shows the intense congestion, intense hyperemia that occurs during the process of iritis. And it's quite possible, of course, that this lens is also adherent to the surface of the iris in the form of posterior synechiae, although we haven't at this stage got the clear irregularity at the surface of the iris here to indicate that there are severe adhesions from the iris to the surface of the lens. In this example of a rat's eye, which has been taken at a more oblique angle, you can see the hypermature or Morgagnian change that occurs in cataracts. This, a few days previously, or at least a week previously, was a fully formed complete cataract. But at this stage, it shows that there is quite a considerable amount of anterior clearing of the cataract, with the nucleus of the lens still retaining the opaque appearance. It also shows that the anterior surface of the lens, which normally isn't visible in a rat, is quite visible at this stage, which means that there has been some shrinkage of the volume of the lens away from the corneal surface. Of course, not all cataracts are cortical cataracts or start at the back of the lens, and this example is of a nuclear cataract in a dog in the centre of the lens produced by a chemical substance. We've looked then at the ophthalmoscopic changes that can occur in lens. Now let's consider some of the microscopic changes. And the earliest change perhaps are both the swollen balloon fibres that one sees and areas of vacuolation. These then quickly lead on to the fragmentation of fibres, and both swollen balloon fibres and fragmentation of fibres can sometimes be mistaken for artifactual changes that one readily encounters in the nucleus, or indeed post-mortem changes which may occur. The next change is where there is a loss of the posterior cortex, and this results in an abnormally shaped lens. And in the case of a spherical lens, such as the rat, it usually results in a pear-shaped lens with loss of fibres at the posterior pole. There then can be fragmentation and liquefaction of large areas of cortex, up to a point where the whole of the cortex may be completely lost. But particularly in rodents, it's quite characteristic for the nucleus to be spared this process. So usually we see in a cataract, even that's been in existence for 12, even 18 months in a rodent, there can be a nucleus sitting there and the whole of the cortex has been lost. And then the final point here on the list is the where there is capsular rupture and the histological features of the complicated cataract. This slide shows an example of the early change of vacuolation. These may be quite small or may be quite large, and perhaps this is important at this point to point out the differences between the true vacuolation, the true toxic-induced pathology, and the artifactual vacuolation or artifactual cleft formation that occurs in virtually all lenses. The next slide shows ballooning, the ballooning swelling of the fibres that occurs early in the cataract formation. The normal lens is a very regular appearance to the fibres, and these show the irregular features of the swelling. This often then gives rise to these fragmented and liquefied globules of fibre material, of proteinaceous material, and it's this sort of change which can be easily confused with the artifactual change that sometimes is encountered in lens material. This slide shows an example of a rodent, a rat in this case, lens, where the posterior cortex has been lost from the lens. This shows the outline of the nucleus, and the whole of the posterior cortex has undergone fragmentation and loss. But of course the loss which occurs in the posterior part of the lens is shown even more dramatically in this slide, where the only remaining part of the cortex is the anterior part, which itself shows marked cataractous change. Occasionally you can get other changes occurring in the lens, and this is an example of proliferation of the anterior lens epithelium, which sometimes occurs as a secondary feature and perhaps as an attempt of the lens to undergo repair. But no matter how proliferative and how extensive this multiplication of epithelial cells is, it is always ineffectual and never produces any true regeneration of fibres. And in many cases this proliferation actually adds to the opacity that occurs, because proliferation of anterior lens epithelium in its own right, without any other change, will give rise to opacity. The features of the complications which can occur in severe lens pathology are shown on this slide, and include the lens-induced uveitis. That's due to the release of immunologically active proteins from the substance of the lens. This can give rise to vitreal inflammation, which may lead to liquefaction of the vitreous and retinal detachment. There may be anterior hemorrhage in the complicated case, and frequently there may be blockage at the filtration angle, giving rise to glaucoma. And sometimes we see both anterior chamber hemorrhage and glaucoma occurring in the same eye. The effects of the glaucoma and the iritis may give rise to abnormalities in the corneal endothelium, giving rise to corneal edema, and sometimes keratitis is seen also as a secondary complication. Probably the keratitis is related to devitalization of tissue as a result of the inflammation occurring in the anterior chamber. This slide shows an example of a rat's eye with a long-standing cataract, and there is quite marked retinal detachment. And the retina, the only points of attachment of this particular retina are the ora serrata and the optic nerve. There's also in this slide adhesion of the retina to the posterior surface of the lens, and also adhesion of the iris to the anterior surface of the lens. So there's quite a lot going on in this particular eye, and you'll see here the dark blue basophilic material shows that there is also calcification, and this particular cataract had probably been in existence in the excess of 1 year. This slide shows the features of anterior chamber hemorrhage, and also there is undoubtedly glaucoma as well in this eye, with there being marked material and marked swelling and expansion of the anterior chamber. Clearly this is a long-standing cataract as well, and the only remaining part of the lens is the nucleus, as in the previous example. The whole of the cortex has disappeared. It might be useful also to notice that in this particular example you can see small amounts of floccular material in the vitreous, which probably denotes that the vitreous has become liquefied, and there is already the early stages here of retinal detachment, probably related to the liquefaction of the vitreous and the uveal reaction which takes place due to the loss of all these lens proteins. So we've covered some of the changes, both the ophthalmoscopic and the histological changes that we can see in cataracts. So now we ought to move on and consider what types of cataracts we get as a result of toxic damage. In the past, cataracts have often been classified according to whether they're cortical or nuclear, anterior or posterior, juvenile or senile, in other words, according to their anatomical location. Unfortunately, particularly with respect to toxic cataracts, this is not all that useful. The site of the cataract doesn't allow you any information with respect to the chemical which has caused that particular type of damage, and also it's true that many of the cataracts which occur as a result of toxic damage happen to start in the posterior part of the lens, and ultimately, and maybe fairly rapidly, cause changes in the whole of the lens. Therefore, consideration of a classification system on the basis of anatomical location is not that useful. And the following is an attempt at a more mechanistic classification system, and there are examples of every category which are shown here. And the first is where there's an altered carbohydrate metabolism. In other words, substances which adversely affect the carbohydrate metabolism in the lens. There are substances which adversely affect cell division, and there are substances which produce free radicals to produce damage in the lens. There are examples of substances which uncouple oxidative phosphorylation, there are substances which cause disturbances to protein metabolism or inhibit enzymes. And there are known examples of chemicals which induce cataracts, which do so via a perturbation of the lipid metabolism in the lens. So the first slide here, the first example of this then, is where there is altered carbohydrate metabolism. And the best example of a of this is the cataract that is produced as a result of excessive levels of sugar in the lens. And of course this is the situation which occurs in diabetes, where the abnormally high levels of glucose in the lens saturate the normal anaerobic metabolism of carbohydrate in the lens and give rise to the alternative pathway producing the sugar alcohol via the aldose reductase pathway. This accumulation of the sugar alcohol, because it is non-diffusible, causes an accumulation of water in the lens, which gives rise to an increase in the amount of water and hence a decrease in the transparency. And the large accumulation of water eventually inhibits the normal metabolism of other fibres in the lens and results in structural damage. As well, of course, as the example of chemical substances such as streptozotocin, which induce diabetes mellitus type syndrome, there are other sugars which in excess may produce this type of cataract, and of course galactose is one example of this, where of course in very young rats feeding high levels of galactose will result in a carbohydrate type cataract, as will the inherited deficiencies which are occasionally encountered in man and in animals. Perturbation of cell division is important because some chemicals interfere with cell division which occurs in the anterior epithelium in a similar way to that which is produced by radiation, and radiation is well known as producing cataracts. And many of these drugs are the anti-cancer drugs. Quinoline derivative here and busulfan are two examples of chemicals which interfere with cell division, and because there is constant cell division in the lens epithelium and constant addition of new fibres to the lens is always susceptible to this type of damage. 2,4-dinitrophenol was a compound introduced in the 30s as a slimming aid, and this unfortunately produced cataracts in man. It was rather difficult in experimental animals to reproduce this change, and it was some years before it was eventually discovered that chickens were quite susceptible. And but feeding the compounds to rats generally did not produce the cataract that occurred in man. And this is now known to act by alteration of phosphorylation with an increased oxygen consumption within the lens. Compounds which interfere with protein metabolism and inhibit enzymes, because the lens is a very protein-rich organ, these substances have the potential for producing cataractous change. And this slide shows two examples of that. Naphthoquinone inhibits the enzyme which is responsible for the pumping of sodium and water out of the lens and maintaining its transparency, and hence will produce cataracts by this mechanism. Chlorophenylalanine interferes with phenylalanine metabolism and hence interferes with the normal synthesis of lens proteins. Substances which alter lipid metabolism in the lens will also have the potential for producing cataractous change. There is continual fibre production in the lens, and this continual fibre production requires an active lipid metabolism to produce plasma membranes. Cholesterol is required for this membrane synthesis, and the lens synthesizes its own cholesterol and has its own metabolic enzymes for this process. And substances which interfere with this cholesterol metabolism have the potential, if they gain access to the lens, of producing cataracts. And there are a number of examples of this. Triparanol is the oldest example, but many of the modern hyperlipidemic drugs, particularly the vastatin compounds, have the potential, at least in experimental animals, of producing cataracts. And certain substances, even though they're not meant to be hyperlipidemic drugs, do have as a side effect interference on the normal metabolic processes of cholesterol. So this is quite an important mechanism of cataractogenic formation in toxicology. Before we move on to the retina, the one mechanism that I haven't mentioned is the excessive production of free radicals, and the best example of this is of course diquat cataract, which is known to produce free radicals. Its known toxicity is related to the production of free radicals, and this is thought to be the mechanism by which the cataracts of diquat are formed. Okay, we now move on to the third part of the eye, and this is of course the retina. And we'll start by mentioning some of the features, the anatomical features of the retina, which are important in toxicology. The first one is that the retina is formed from the eye is formed from the optic vesicle as an outpouching of the brain, and involution of this vesicle produces the two layers of the retina. The first layer, the inner layer, undergoes massive cell division and differentiation, and that this inner layer ultimately becomes the neurosensory retina. And there are a number of layers to this neurosensory retina in the adult animal. The outer layer of this cup retains its simple structure and becomes the retinal pigment epithelium. This slide is from a 17-day-old rat fetus and quite nicely demonstrates this two-layer structure of the retina. Here we have the inner layer of this cup, which forms the neurosensory retina, and even at this stage has got these multiple cell layers. The outer layer of this cup here is the simple epithelium, which remains fairly a simple cuboidal epithelium and remains as the retinal pigment epithelium. Also note at this stage, incidentally, we have the lens, which is quite well formed, and the vesicle of the lens has been obliterated at this stage by the production of these primary lens fibres. The retina doesn't just contain neural elements, it also contains glial elements and vasculature, and all these three elements are important with respect to toxicology. This slide shows the normal anatomy of the neurosensory retina and shows the 9 layers from the photosensory cells, the rods and the cones on the outside, to the ganglion cell layer on the inside, with a inner nuclear layer in the middle, composed of bipolar, amacrine, horizontal and Muller cells, the supporting cells, and plexiform layers in between. And this semi-thin section is quite a nice slide showing the various portions of the neurosensory retina, from the photosensory cells here synapsing with either the bipolar cells or the amacrine or horizontal cells of the inner nuclear layer, which then synapse with the ganglion cell on the inner surface of the retina. This portion here, which has been inked in, shows the structure of the Muller cell. The outer layer of the retina is the simple retinal pigment epithelium at the base there. But perhaps more familiar than that is this appearance, which is the normal appearance in H&E section of the retina, again showing the multiple cell layer of the neurosensory retina and the single cell layer of the retinal pigment epithelium. This is from an albino rat, so consequently there is no pigment in the retinal pigment epithelium cells. Most of the photosensory layer here is taken up with rods because the rat has a rod-rich retina, and the cell bodies of the photosensory cells perhaps form the thickest layer. The proportion of cells in different parts of the retina, of the outer nuclear and the inner nuclear and the ganglion cell layer, vary from species to species depending on their various neural connections. Not only do the number of cells vary depending on the neural connections, but they also vary depending on the age of the particular animal. This is from a newborn animal, 1 day old, a newborn rat, where the retina is not yet developed, and you see that most of the neurosensory retina is relatively undifferentiated at this stage and contains many more cells than would appear in the mature retina. Clearly there are a number of cells which have to be lost from this retina to become the normal and mature differentiated retina, so the appearance of apoptotic bodies at this stage and even beyond this stage is perfectly normal and does not represent a pathological change. This slide shows the difference between a relatively young but mature rat retina and the retina from a very old animal. So the appearance of the retina can vary depending on the age of the particular animal, and it's important to recognise this fact when studying for toxicological effect of chemicals. The actual photosensory layer contains inner and outer segments. The photosensory cell itself contains inner and outer segments, and the outer segment contains a number of discs, and it's upon these discs upon which lie the pigments necessary for the vision process, the process of vision. The inner segment of these contain the mitochondria and the rough endoplasmic reticulum, and the two portions are connected with a cilium. This is a photomicrograph showing the outer part connected to the inner part, and it shows the large number of discs upon which the photopigments rhodopsin lies. These discs are important for two reasons. One, there is a constant addition of discs onto the top of the disc, as it were, and a constant removal of discs at the bottom by the retinal pigment epithelium. And this turnover of cells is important because some toxic chemicals have their effect on the actual turnover process. The retina contains non-neural cells, and there are the glial elements, or the Muller cells, and of course the retinal pigment epithelial cells. And both these cell types have important functions with respect to the overall photosensory activity which occurs in the retina. This slide lists some of the functions of the retinal pigment epithelium, and one is that it forms a component of the blood-brain barrier. The second is that there is a transportation of ions, of metabolites and water between the retina and the choroid, and clearly this has to pass through this retinal pigment epithelium. The retinal pigment epithelium is also involved in the visual cycle, and we'll mention a little more about that in a moment, and the alteration of the actual pigment and the bleaching process of the pigment. And the retinal pigment epithelium also regulates various ion levels within the retina. And perhaps one of the most important functions is phagocytosis, which occurs by the retinal pigment epithelium, by which case there is removal of the worn out discs as new discs are added at the surface of the rod. The next slide shows some of the features of this disc shedding and phagocytosis, and it's quite a complicated process, and perhaps the details of this process are outside the scope of this particular talk, but the retinal pigment epithelial receptors enable recognition of the worn out outer segments. It doesn't recognise normal outer segments, but only recognises them when they become worn out, and there is a binding procedure takes place on the outer segments, and a generation of signals and second messages giving rise to the ingestion of the worn out disc by the retinal pigment epithelium. And it's possible that chemical substances adversely affecting the retinal pigment epithelium can adversely affect this turnover mechanism and consequently cause severe abnormalities in the retina. And this slide shows an example of, it's an electron photomicrograph of a retinal pigment epithelium cell, and here we have portions of worn out disc which have already been phagocytosed and taken into lysosomes. As we've said, the Muller cell is also of importance and is important in the regulation of extracellular potassium, which is involved in the transmission of electrical activity. It's also important in the active uptake of neurotransmitters, and provides quite considerable structural and metabolic support for the neurons. It forms the glial element of the retina. And it's particularly of importance during development when it assists in the normal development, migration and differentiation of the neurons during the